So today we have discussed different tools and techniques used for evaluation. So we are left out with three tools and techniques used for evaluation. Those are OSCE and OSPE, then your Likert scale, then semantic differentiation scale. So today in today's class we are going to discuss the three topics. So let's start with your OSCE. So wait, let me take out the slide. Yes, so OSCE, I think everyone have idea what is OSCE. OSCE and OSPE. What is the full form of OSCE and OSPE? It is the obstetric structure clinical examination. Obstetric structure practical examination. So then OSCE and OSPE, it is a modern type of examination to assess the clinical skill, performance and competence in skill. For example, communication, clinical examination, medical and nursing procedures and prescriptions, exercise prescription, joint mobilization techniques, interpretation of the results. So these are the things you can evaluate through your OSCE and OSPE. So the definition of OSCE and OSPE, what is the definition? So you can say it is an assessment tool in which the components of clinical competence, for example, history taking, physical examination, simple procedures, interpretation of lab result, patient management problems, communication, attitude, etc., can be tested by using agreed checklists and rotating the students around a number of stations, some of which have observed with the checklist. So these are the things you can use. For example, history taking, physical examination, simple procedures, communication skill, attitude, etc. You can assess through your OSCE by using checklists or by rotating the student from one station to another station. So how to conduct OSCE and OSPE we'll learn in our next slide. So what are the practicals? Before that, what are the practical skill you can assess through OSCE and OSPE? So these are the few example of clinical skill you can assess through OSCE and OSPE. First one is the interpersonal and communication skill, history taking skill, physical examination, mental health assessment, clinical decision making and clinical problem solving, interpretation of clinical finding, management of clinical situation, patient education, safety in the urgent clinical situation, basic advanced nursing care procedure practice. These are the few example of your practical skill you can assess through your OSCE and OSPE. Then let's discuss how you can organize a OSCE and OSPE. So for organizing an OSCE or OSPE, first the examination. So first let's see the examination. It consists of 10 to 15 stations, then each of which requires about 4 to 5 minutes. Then the number of station and time spent on each station may vary based on the needs of evaluation. So it can be consist of 15 to 10 station. You can make 15 to 10 station. Then each station may require 4 to 5 minutes, but again it vary according to the procedure or according to the topic of evaluation. Sometimes some station it may contain 10 to 15 minutes also, because it's depend on the evaluation. For example, if you want to assess the if you want your student to give evaluation, if you want your student to evaluate on the physical examination, so physical examination within 5 to 10 minutes you cannot complete. So minimum 10 minutes the student will be needing to perform the physical examination. So again it depend on your evaluation. Then all stations should be capable of being completed in the same time. So it is a cycle. So you have to try to complete all the station in a particular time. Then the students are rotated through all station, have to move to the next station at a signal. So the student here in OSCE or OSPE, what you are going to do, you want to move the student. So you are going to make 4 or 5 station according to your need, or 10 to 15 station according to your need. But here you have to rotate your student from one station to the another station. For particular station, particular time limit will be there, particular evaluator will be there, particular tasks will be there. Okay, so then suppose for example in the one station your student have completed his or her tasks, then the next station you have to shift the student. So how you are going to shift the student to the next station? In a signal. Maybe the first station evaluator can give the signal, or maybe in the second station evaluator can give the signal, and with the signal you can shift your student from the one station to the another station. Then the students are rotated through all station and have to move to the next station. Okay, we have discussed this point. Then as the stations are generally independent, student can start at any procedure station and complete the cycle. So again it's vary. Some stations are dependent to each other and some station they are independent. So for example, suppose the physical examination procedure you want to assess through your OSCE and OSPE. That time the physical assessment procedure you have to divide in the station wise. So if you want to assess one particular procedure in the station wise, then the station will be dependent. Suppose you want to assess different procedure through OSCE and OSPE, the station will be independent. Okay, so it is depending on your procedure of evaluation. Then using, this is an example, using 50 station or 4 minutes each, the 15 student can complete the examination within 1 hour. So if you are giving 15 station and each station for 4 minutes, then 15 student can complete the examination within 1 hour. This is just an example, but again time limit it is to vary according to your procedure, according to the evaluation. Then organizing. Next step, what is that? Each station is designed to test a component of clinical competency. So each station will be designed to test a particular task of the student. So each stage is different. Suppose you want to assess the hand washing for physical examination. Okay, again take the example of physical examination. So you have to make station. One station you can assess the introduction, you can ask your student to introduce yourself. Next station you can check their IPR. The next station you can check the proper physical examination of the student. So here you have to divide the whole procedure in the station wise. So particular station, the particular task the student will be performed, it will be well defined from before. Then at some station you can call the station procedure. In the procedure station the student will perform the procedure, and some station you can call response station. In the response station you can ask question to the student and they can respond to the particular question. So you can evaluate in that way also. So for example, physical examination, in the introductory session you can ask the student their names, then you can assess by using checklist or observation skill, you can evaluate the student. And in the physical examination, the main station, you can tell them to perform the procedure. So that one will be known as your procedure station. Then let's discuss the advantages and disadvantages of OSCE. So advantages are, it is a more valid than the traditional approach to clinical examination. Then examiner can decide in advance. Obviously we can decide in advance what to assess. Then examiner can have better control on the content because everything will be under examiner control. In OSCE and OSPE everything will be well defined from before. The timing, the tasks, the evaluation, the techniques of evaluation, everything will be decided. Then more reliable, the use of checklist by the examiner. So you can use the observation checklist to assess your student. Then disadvantages. Okay, student knowledge and skill are tested in the compartment. Yes, here we are assessing the student knowledge in the compartment wise or in the station wise. We are not assessing the student as a whole. For every station the student will be evaluated and she will be graded or she will be given marks. So you are not evaluating the student as a whole, you are evaluating the student as a station wise. Then demanding from, okay, this is very demanding because everything you have to pre-plan, everything here. So tasks, time, evaluation, techniques, everything will be pre-planned. That's why it is demanding. It needs time to conduct a OSCE and OSPE. then examiner are required to pay close attention to the student repeating the same tasks. You have to keep close eye on your students so that they should not go to the same station again and again. They should move accordingly, according to the pre-plan. They have to move from one station to the another station, so you have to keep close eye on your student that they are moving from one station to the another station. Then maintaining uniform difficulty level is always possible. So again, you have to keep close eye on your student, otherwise the uniformity of the procedure will not be maintained. So these are the some disadvantages of your OSCE and OSPE. Then Likert scale. So I hope OSCE and OSPE is I think everyone have understood the topic. So from here you may get as a short notes. Okay, so you may get a question as a OSCE and OSPE short notes for 5 marks. This type